6:10. Work to add fluoride to the water supply in Rotorua is being halted after a preliminary High Court ruling found the mandate to do so is unlawful. It comes after then Director General of Health Sir Ashleigh Bloomfield last year directed the council to fluoridate its central and eastern water supplies by April 2024 in a bid to improve poor dental health in the area. For more, we're joined by Rotorua Councillor Robert Lee, who opposed the mandate, and New Zealand Dental Association's Rob Beaglehole. Rob, I'll come to you shortly, but Robert, I wanted to start with you first. How are you feeling about this court ruling?
Well, I think the court ruling is very good for New Zealand. It respects our Bill of Rights, and the Supreme Court has been trending to strengthen our Bill of Rights in recent times, so it's very good.
Okay, what were your main concerns about fluoridating the water supply in Rotorua?
Firstly, the public have not been consulted, so the public have been excluded from participating in the process of deciding whether it's a good thing. Another thing is that Section 11 of the Bill of Rights, which is a very important right, gives us all the right to refuse medical treatment. And the Supreme Court decided in 2018 that fluoridated water supplies is a medical treatment, and it's a compulsory medical treatment because you can't opt out of it.
Right. Although, Robert, you talk about the public not being consulted. We've been fluoridating our water supply for more than 50 years now, so it's not like this is a new thing. Why are we still debating this in the first place?
Actually, the 2018 decision gives a nice history of fluoridation in New Zealand, and Chief Justice Sian Elias came to the conclusion that local authorities have never had the statutory authority to fluoridate, going back to the 1950s. All the legislation ever provided councils was the instruction to provide drinkable water.
Sure. Although there are consistent studies, consistent research that when we consume it in safe quantities, it helps our teeth. And clearly, the Director General of Health decided that there was something going on in Rotorua that needed addressing in terms of the teeth health of the residents there.
Well, there's a number of ways of treating oral health, but you're right. The latest scientific research is very important to review, and that's what I have right here. So this is research published in May 2023, and it finds that there is serious concerns about the neurotoxicity of fluoride. So it actually adversely affects the IQ of children. So this is research out of the United States government.
Okay, the Dunedin study disagrees with you there, Robert. This is world-renowned, multidisciplinary...
They're disagreeing with the United States research.
Yes, absolutely.
And that's research which, by the way, the Director General of Health has not considered in making his decision.
Sure, but the Dunedin study, which has followed the development of people born in Dunedin in the 70s, their analysis showed no significant differences in IQ by fluoride exposure.
So you might be talking about one particular study here. So this research combines 19 high-quality studies, and 18 out of 19 high-quality studies show that there is a reduction of IQ in children of 7 points.
Okay, so
but we're talking across purposes because you're arguing in favour of oral hygiene and the oral results. I'm approaching that from a different perspective. But there are alternatives to improving oral hygiene and oral health. And Scotland has led the way with a program called Childsmile, and this is where they bring toothbrushes into schools, and the children are supervised to brush their teeth, and it has reduced dental cavities by 50%.
Okay. All right, Robert. Hey, thank you so much for your time. There's Rotorua Councillor Robert Lee joining us live this morning. There is concern, though, about this court ruling. So for more, we're joined by New Zealand Dental Association's Rob Beaglehole. Morning, Rob. Where do you stand on this?
Well, the Dental Association is unequivocally clear in our stance that we are totally supportive of
water fluoridation. We are appalled at the state of oral healthcare in New Zealand, particularly about all the pain and the suffering that we have. So we're concerned that the Rotorua District Council is putting their fluoridation plans on hold. Many other cities around New Zealand, including Nelson, are actually pressing ahead, even though the ruling has happened.
There is some evidence that potentially fluoridization of the water doesn't necessarily have as much of an effect as it once thought, as was once thought. Where do you stand on that?
Well, we just have to look at the evidence, and if we look back at the 2009 oral health data that was conducted in New Zealand, they say that there was a 40% reduction in tooth decay amongst people consuming water that had been fluoridated. So there is evidence that it works, and we just need to look at the totality of evidence all around the world, and we need to be guided by the World Health Organization, for example.
Are you concerned that the High Court has essentially removed the power that was given to the Director General of Health by the government?
Well, they haven't removed the power. The issue is it's important to delineate what the ruling was. It was a procedural issue. It doesn't demean the legality of the DG's power, and it also doesn't demean the effectiveness or the safety of water fluoridation. It's only a procedural error, and we are hoping that the Ministry of Health will be resolving this as a matter of urgency so that more and more New Zealanders can continue to have benefit from drinking fluoridated water.
So what would you like to see happen from here then, Rob?
Well, we'd like to see the Ministry of Health sort out the mess. They have their lawyers working on it. We also need to think about the pain and suffering that children and adults are experiencing on a day-to-day basis in New Zealand. I've pulled out probably 25 to 30,000 teeth from children who have tooth decay in New Zealand, and it's heartbreaking. So we want the issue resolved as a matter of urgency.
Rob Beaglehole from the New Zealand Dental Association, thank you so much for joining us this morning. Appreciate your time.
Thanks, Manny.